Hi there, welcome back to another video. Today's video is going to focus on two lists of questions that will help you take a basic history on sexual function after spinal cord injury. Now, just to set your expectations for this video, I only have 2 slides for this video, so a list of questions to ask men and then a list of questions to ask women. So this is going to be a quick snapshot of questions that you can use when you're taking a sexual history from someone after a spinal cord injury. I'm aware that this is a very niche area, and because it's a very delicate and sensitive topic as well, some of us in the industry feel somewhat out of depth talking to patients about this. Therefore, it is very commonly neglected. I am planning another video which will go into counseling someone on sexual function after spinal cord injury. It will be more extensive and more in-depth. Certainly, if you're interested, do subscribe, and if you wish to be notified when that video goes live, do turn on notifications as well. But for today, let's cover these 2 basic lists. So these are the questions that I typically ask men. And as I've said before in other videos, it's really important to compare their pre-morbid function versus their function after injury so that you can gauge which changes are new. And also, if there's someone who experienced a spinal cord injury many years ago, what will be most relevant is to ask what has changed. Question number 1, how often are you sexually active? Question number 2, do you have sex drive like you did before? So the first 2 questions may give you some insight into other causes of sexual dysfunction or an unsatisfactory sex life. For example, low mood, depression, or pain. Question number 3, what is your sensation like? So this is when the patient might say, oh, look, my penis, there's impaired sensation there, or my testicles, they feel different as well, or they might even express that it's dysesthetic or painful to light touch. Question 4, do you still get morning erections? This question gives you an idea whether the vascular structure of the penis is intact or not, as nocturnal penile tumescence happens in the absence of physical as well as psychological stimulation. Question 5, do you get an erection with physical stimulation, i.e. just with psychological arousals? So does the patient get an erection just with racy thoughts or images? This kind of erection is also called the psychogenic erection. Question 6, do you get an erection with physical stimulation? This assesses the local reflex pathway of the penis, and a very easy way to think about this is, for example, if you're checking deep tendon reflexes and with a tendon hammer, you tap on the knee. For an upper motor neuron lesion, you're going to get a brisk knee jerk. For a lower motor neuron injury, there may be no reflexes at all or hyporeflexia. This is similar with regards to erectile function. So if the male patient self-stimulates and they're able to get an erection, it's an indication that perhaps the lower pathways or the sacral pathways are still intact. And an erection with physical stimulation is also referred to as a reflex erection. And what I'm going to say here so that it makes more sense, a person may get an erection from physical stimulation, but it's often the psychogenic or the cognitive input that comes from the brain that sustains the erection. Question 7, how much time does it take for you to get an erection? And this one, it's important to compare before and after as well. Question 8, can you sustain it and for how long? And is it adequate or firm enough for penetrative sex? Question 9, do you experience orgasm? Question 10, do you ejaculate? Now, the reason I separate these 2 questions is because although orgasm and ejaculation do occur simultaneously when the nervous system is intact, they are actually separate processes. The orgasm is a sensation experienced by the brain. Ejaculation is literally travel of the semen from the testes to the external space. And after a spinal cord injury, sometimes patients experience one and not the other. Question 11, are you satisfied with your sex life? And if not, what are your goals or expectations? This question is certainly really important for counseling and developing a management plan. Question 12, which is more of a task. You do need to review their bladder and bowel function. And really the question that you ask in this situation is, do you have a good bladder and bowel regime? And do you empty your bladder and bowels before you have sex? And this is certainly important because if the bladder and bowels are full, you get all sorts of conflicting feedback from these organs to the spinal cord. And that's potentially why things may not work. The other issue is if someone does not empty their bowels or their bladder before sex, there's a risk that during orgasm, they may inadvertently wet themselves or soil themselves. So this is certainly important because patients can feel very embarrassed if this happened. Now, for men, this is especially important because vascular etiology are the most common contributing factors to erectile dysfunction. So review if they smoke, do they have diabetes, hypertension, high cholesterol, and if so, these need to be addressed as well. Here's the list for women. So question 1, how often are you sexually active? Question 2, do you have sex drive like you did before? Question 3, what is your sensation like? Question 4, how is lubrication? Question 5, is there any pain during sex? Question 6, do you experience orgasm? Question 7, are you satisfied with your sex life? What are your goals or expectations? And also review bladder bowel function. So for women, although the list of questions seems much simpler, managing women can be, in fact, a little bit more complicated because women and men are built somewhat differently when it comes to feeling satisfied with their sex life. If we're talking about motor sexual function, women certainly have a bit more of a passive role. But women enjoy sex or experience quality of life with sex more on a psychological level. So I hope you found this video helpful. If you have any questions, please leave them in the comment section below. If you found this video helpful, please hit that thumbs up button because it will help this video spread to more people. Thank you so much for watching.